I took a look at the informed consent form for an organization called Redeemer Counseling Center, which is located in Orlando, Florida, and they're composed of 11 different licensed mental health counselors. In comparing their informed consent form with the ACA Code of Ethics recommendations, as well as the state of Florida's laws on informed consent, I think overall they did a good job in including most of what the ACA recommended. Um, Although, because I think because of the nature of it being a collection of or a group of counselors, some of the things can't be explicitly included in the general informed consent form. So specifically, what I have in mind, they do mention the procedures of counseling, such as the counseling times, the importance of being there on time, and payment expectations. They talk about the limitations and potential risk of counseling, such as they expect benefits, but the benefits are not guaranteed. They warn that the client may experience some emotional strain. They may feel worse before getting better, and they may make changes which could be distressing. They also are clear about the purpose of the organization as a whole, it being they're respectful of all religions. They're coming from a particularly Christian perspective, and they seek to serve the local community there in Orlando. They're clear about the qualifications of the counselors, which is that they require them to have a master's in counseling and to be licensed as mental health professionals by the licensed mental health counselors in the state of Florida. Things that they don't mention explicitly in the general consent form is the techniques, goals, and the benefits. However, these can be found in the individual counselors' biographies. They mention specific techniques that they like to use. So I'm wondering if perhaps it would be good to recommend to Redeemer Counseling Center that they include maybe a general list of potential techniques that the individual counselors might use, just to make that part of the general informed consent form. One thing that they don't have in the new or in the general informed consent form is explicitly talking about teletherapy, which I imagine there's a lot of catching up to do with the COVID situation, with teletherapy becoming a more prevalent mode of counseling. I read a article titled "Making the New Normal: 5 Tips for Providing Teletherapy" by Andrea Chandler. And in that article, she recommends, in terms of teletherapy, including that in the informed consent form. And she mentioned some of the, making sure to include some of the other things I've already mentioned, but also specifically with teletherapy, mentioning the platform that will be used, such as Google, Zoom, etc. Um, and she mentions, including the therapeutic modality, so the specific technique. And then she also recommends the mentioning the possibility of technology failure, and to suggest alternative methods, which I thought that was would be very helpful and comforting to potential clients, and as well as the location of the practitioner. If it is a telehealth situation, the client may feel more comfortable with someone that they know is familiar with a particular culture, based on geographic location. Um, but yeah, I thought that would be potentially helpful for the Redeemer Counselor Center to implement the telehealth aspect into their informed consent forms, um, as well as a potential list of offered techniques.